Hari Om Namaste. I am Dr. Gopalkrishna. Few years back, I was diagnosed a case of HOCM, hypertrophic obstructive cardiomyopathy, with severe mitral regurgitation, for which the surgical procedure was advised, and the team headed by Dr. Javali sir and also the whole team of Fortis took over the case. Before that, I met Dr. Srinivasa Prasad. We got admitted here. I underwent the surgical myectomy along with mitral valve replacement. Following that, a month after, I developed bleeding disorder to say coagulopathy, particularly the acetylene related, the anticoagulant related INR derangement, for which again I got admitted in Fortis.
Hi, this is Dr. Srinivasa Prasad. I'm a consultant interventional cardiologist and a structural heart specialist working at Fortis Hospital, Bannerghatta Road. Today I'm going to talk about a case which is called as a paravalvular leak device closure. This patient, Dr. Gopalkrishna, was a very good practitioner who had underwent a surgical mitral valve replacement 2 years back. Unfortunately, post-surgery, over the follow-up, he developed a leak surrounding or just next to the valve, that is a paravalvular leak.
Just 4-5 months back, in the month of January-February this year, 23, I developed a massive right-sided heart failure along with pneumonia. I got treated for that, but following that, since the mitral regurgitation was severe, I was supposed to undergo another procedure.
This patient also had an episode of an heart failure, which was a kind of a near life-threatening for him in February 2023. Though he was stabilized then, he continued to have a significant symptoms to the extent that even a daily routine activities like taking bath used to be very, very strenuous for him.
The Fortis people took it as a challenge to undertake different method of solving the problem. Then they suggested me the angiogram and percutaneous method of closing the device closure of the paravalvular leak, PVL leak closure with the devices. When the condition was totally diagnosed and the investigations were done, they said probably one single device may not be sufficient to close the leakage. Hence, I planned that multiple devices needs to be placed, for which again a procedure was planned. I was again got admitted in Fortis.
When he came to us with these kind of symptoms, there were only two options. So one is redo surgery, which is very, very high risk. Second is a percutaneous transcatheter paravalvular leak device closure. We discussed the case with the entire heart team as well as the patient and the patient attenders, finalized with the paravalvular leak device closure. This was quite high risk procedure and the defect was quite huge on cardiac CT as well as a cardiac MRA. So what we did is we went ahead with the procedure under general anesthesia. We, through a percutaneous route, that is through the vein in the groin, we crossed over to the left side of the valve. The defect was quite closer to the walls of the heart, so hence difficult to access. But with all our skills and with very good infrastructure over here, we could cross it and close this device with the two large devices. This is one of the defect, this is one of the largest defect being sealed in the entire country as of now.
I could feel the change in my life. Before this procedure was done, I was unable to even walk for 10 to 15 meters. Staring up 4 to 5 steps was very, very difficult for me. But after the procedure, within 24 hours, I was able to walk in the ICU department itself. After that, now about a fortnight passed after my procedure is over, now I can walk for more than 9,000 steps a day. This is what the change that I am, particularly myself, I am feeling, I am experiencing that, for which the whole of the Fortis team is responsible. They have given me another life.
So post which, on table itself, the patient had a drastic reduction or almost a complete resolution of a leak, and also the pressures, everything became normalized. Very next day, the patient was quite ambulant, feeling fit and energetic, and is back to practice within a week or so. We are happy for him, and this is a message to all the patients not to worry about a high-risk redo procedure. There are a lot of transcatheter procedure. As a structural heart interventionist, we do at Fortis Hospital.
I should thank here the team of surgeons led by Dr. Javali, particularly Dr. B V Srinivasa Prasad, but also the care what they are giving is extraordinary, is excellent. Now Fortis is world-renowned institute. Thank you very much. The improvement that has given me within 24 hours after the completion of this particular procedure. Thank you very much. Thank you, Fortis. I love Fortis.